Greetings, everybody. My name is Alejandro Daniel Murga Gonzalez. I will be the moderator of this conference. I will let you know that on the chat there's a link, registration link. Hay un link de registro, por favor. Darle clic a todos los asistentes para registrar la asistencia. On this link, you will register the assistants, so please go on the Google Forms link. For me, it's an honor to present the Keynote Conference, Challenges and Progress of Delivering Drugs to the Brain, presented by Dr. Teruna J. And I will read his semblance, his trajectory. Dr. Teruna is a research professor from the Aya and Takeru Higuchi Distinguished Professor, Department of Pharmaceutical Chemistry, the University of Kansas, Lawrence, Kansas, United States. Dr. Siahaan had been published more than 195 papers with an impact of 5,264 citations of his articles. His research lines are from drug delivery and targeting, autoimmune diseases, and also Teruna's research interests are in utilization and modulation of cell adhesion molecules on the cell surface for targeted drug delivery to specific cell type and for enhancing drug permeation through the intestinal mucosa and blood-brain barrier, BBB. So I let the microphone to Dr. Teruna. Welcome to this conference and this Congress. Thank you, Doctor.
Thank you, Alejandro, for the nice introduction. I think good morning, everyone. So I'm going to begin to share my slide. Okay. So right now, okay. Can you see my slide?
Yes, sir.
Okay. Okay, thank you for the organizer for inviting me to give this lecture. Please interrupt me if something's wrong with if some things get cut off. So I'm going to talk about how we try to improve drug delivery to the brain. So what I'm going to talk about today is that our progress and challenges that we see in the last 30 years. So it's very difficult to deliver drug to the brain. And one of the reason is because we have this, what we call blood-brain barrier. So if you know that 98% of small molecule drugs that currently available cannot be delivered to the brain. So lots of anti-cancer drugs that can be used to treat cancer in the other part of the body cannot be used to treat the brain, brain tumors, for example. So some drugs can be delivered using ICV. It means by, let me change my pointer here. Okay, so you can deliver them directly. So this is kind of dangerous a little bit. There's potential infection and inflammation. So there is a need to find a method to deliver drug.
Doctor, I just wanted you to know that we're seeing only the first slide of your presentation.
Yeah, that's why. Okay. I just excuse me. Sometimes this is what stop presenting. So what? Okay. I don't know what's happened there.
Okay, maybe if you just let the PowerPoint presentation open without the presentation mode, maybe it won't stuck on the first slide.
Okay, I can do that. Just a second. Let's see if I do this entire screen. Can you see my slide?
Yes, the actual number 2 slide.
Okay, can you see number 1?
Yeah.
Number 2? Why don't I use this way? Is that okay, this way?
Uh-huh.
Okay, let me make
Go ahead. Thank you.
Yeah, this is probably better. Okay, so what happens is that it's very difficult to deliver molecules to the brain. The reason is you got this blood-brain barrier. So the blood-brain barrier is very selective and restrict molecules to get into the brain. So there are many methods that people use to deliver the drug to the brain. So our goal is actually try to develop a non-invasive method to deliver drug to the brain. So as you know, brain diseases like Alzheimer's, multiple sclerosis, and brain tumor is very difficult to treat. The reason is it's not easy to deliver molecules to the brain. So one of the things that we are doing currently, there are people try to deliver neurotrophic factors or antibodies to the brain, either to stop the progression of neurodegeneration or to stimulate the nerve growth. Okay, it means in MS, people are trying to deliver this antibody here for regeneration of the axon or remyelination, for example. So there are a couple of antibodies for Alzheimer's disease been it's failed in the market, and there's one that recently got approved. So one of the problem is that it's very difficult to deliver them to the brain. So if you want to deliver them, obviously we have to understand what is the barrier. So one of the barrier is what we call the blood-brain barrier here. So the blood-brain barrier is actually microvessels or tubing that going through your brain, and they deliver nutrients. So usually nutrient can pass through the blood-brain barrier. But the problem is normal drugs cannot get through that barrier. So if you look at here, this is the cross-section of the blood-brain barrier, and most molecules, like small molecules that follow the Lipinski rule, they usually go across the transcellular. But the problem is for peptides drugs and protein drugs, you cannot go across here because of the physicochemical properties of the molecule, unless they have receptors. So some of the molecules, protein molecules or peptides that can cross through the transcellular, they cross because they have receptor, so receptor mediated. The other problem is we have this, what we call an efflux pump. So a lot of anti-cancer drug, they got efflux back to the blood, they can't get into the brain. So alternatively, what we can do is we can look at the paracellular pathway. What is that? The paracellular pathway is actually the junction between either two-cell or two-cell membranes. So the paracellular pathway will let small ions and or molecules less than hydrodynamic less than 11 angstrom pass through that junction. We call it paracellular pathway. So this is the one that we're going to exploit to see if we can deliver a molecule that way. So you can envision this paracellular pathway like a Velcro. So they have protein-protein interaction in the Velcro. There's some porosity there, but it's very tight. So what we are trying to do is try to make the sum of this interaction, protein-protein interaction, they are inhibited. So you are creating some kind of pore. So in order to do that, we have to understand what is it in the tight junction in that paracellular pathway. So here, if you look at, this is the membrane from one cell, for example, and then this is the other. At the very top here, we call it tight junction. They are very tight. They're only allowing molecules, small molecule cross. And then they are populated by occludins and claudin and jams. And the bottom here, they call it adherent junctions. And what we are focusing is this cadherin here. And at the bottom is desmosome. And actually, desmosome is in the cadherin family. So what we're thinking is, what would happen if we inhibit this interaction, presumably because the the cytoplasmic domains connected, they will regulate this one and allow molecules to get in. So this is our general idea. Our general idea, when you have a drug, there is no modulation, and it's very difficult for them to diffuse. And then if we design what we call it blood-brain barrier modulator, which is a peptide derived from cadherin, so the peptide will bind to cadherin and block or inhibit this cadherin-cadherin interaction, and it opens the junction and let the molecule pass through the paracellular pathway or intercellular junction. So early on, this is way in 1992, we begin to work on this to design the peptide. At that time, we don't have any X-ray structure, but they studied that there's what we call an HAV peptide can block interaction of N-cadherin. So, and later on, when the NMR structure was published and we do some molecular modeling, and we have another peptide where we found that can modulate this interaction. So throughout the talk, you'll hear HAV peptide and ADT-C5 peptide or ADT peptide. So we tested the idea with monolayer, cell monolayer, the model for blood-brain barrier. And what we did is we are measuring the electrical resistance. Basically, when the junction is tight and the cell's normal, you got this no 100% resistant, basically. And then if your molecule can modulate the junction, then the paracellular will be leaky. And as you can see here, the HAV peptide can drop the tear value. And then if you switch the medium, they reseal back. So the peptide is actually modulating the junction by binding to cadherin, and obviously peptide protein binding is an equilibrium fashion, and sooner or later, if you wash the peptide, they will reseal. This is what we want, because if the junction is open too long, therefore other molecules can get into the brain. So we don't want that. So we want them to open and deliver the molecule and close. So we tried this with mannitol. So mannitol is paracellular marker, and then we put the mannitol at the apical, and we measure the transport to the basolateral. As you can see, this is the P apparent. Okay, when we put our HAV6 peptide, you can see there's 8 times enhancement in termination here. And then if you just modify one amino acid here from S to A, you can increase the activity of modulation to deliver 17 times mannitol. So we are quite happy with this, at least in vitro and cell culture. So what would happen in vivo? So in this case, we are using what the model called in situ red brain perfusion. So we are trying to deliver danomycin. Danomycin is an anti-cancer drug, but the problem with danomycin, it is a substrate for efflux pump, so they cannot get into the brain easily. So the idea is, even though they get efflux, if we open the junction, therefore they can penetrate to the paracellular pathway. So in this model, you perfuse the drug and the peptide, and then isolate the brain, and then measure the radioactivity. So as you can see here, A and B, the A is danomycin alone, and B is a danomycin with a scrambled peptide. So we use our HAV peptide, we scramble the sequence to make sure we have a good control. As you can see, A and B, there's no difference. However, when we add HAV6 and danomycin, you can see an enhancement of penetration of danomycin. So essentially, the danomycin penetrate through the paracellular pathway. Now, if we block the efflux pump, so you block this part here, the danomycin will enter through transcellular, not paracellular, and you can see the enhancement here. Then what we did is, what would happen if we mix HAV peptide and verapamil, which is, it means you are doing two transport. One is through here and the other one through here, and you can see the enhancement. Now, the problem with this method, when you deliver the donomycin, the verapamil probably also come off the PGP, the efflux pump. So if we put consistently the verapamil and HAV6, you can see the enhancement. So we were quite happy about this. But one problem, this is not quite in vivo, because what we are doing is we are delivering perfusate, it's not a blood. So we want to look at how we can deliver molecules to the brain using live animals. So what we rely on is what we call MRI, magnetic resonance imaging. So we deliver MRI enhancing agent, GDTPA, and then either we incubate it with our ADT. In this data here is we incubate it with HAV6. So as you can see, this is a control. You can see some gadolinium still penetrate to the blood-brain barrier because the molecular weight is about 700. And then as you can see, after 9 minutes, you can see a lot of gray spot. I hope you can see them. And you can even quantitate the amount that get into the brain. So the nice thing about MRI, you can quantitate, slice the brain, and look at the different level. So here, what we did, when we delivered just GDTPA alone, there is some background, but when we deliver GDTPA with the peptide, you can see the enhancement. It's amazing. It's 3 minutes, we can see immediately in the brain. And then the GDTPA got cleared. If you inject them again, and then you can see the enhancement again and clear. Now, we didn't inject the third time, but because of the animal committee didn't let us do that. But it's actually, I'll just give you the answer. The blood-brain barrier closed after about 60 minutes. I'll show you the data later. Okay, so how about the dose dependent? So we are changing the dose of the HAV peptide here. So the modulator, as you can see, as you increase the dose, you can see a lot more gadolinium or GDTPA in the brain. And here, I put a line here. As you can see, you can deliver the molecule from the posterior, the highest, and then the midbrain and the anterior. As you know, the anterior has less blood-brain barrier or micro vessel going through the brain, and also they are tighter. So this is consistent throughout. Okay, so and then the question is, once you see this in GDTPA, what would happen with other molecules? So we picked a dye called R800. R800 also efflux by the PGP. So this is similar to donomycin that we've done before. So here, because you got efflux, so what we can do is that look at the position in the brain. So here the R800, this is just the brain alone. And when we deliver the R800, you don't see the difference. And then when we deliver the R800 with our peptide, you can see they're penetrating through this junction, and you can see enhancement. Now, what would happen if you just block the PGP? So here, we use GF120918. They block this PGP, you can see the enhancement. So we are quite happy with that, with this data. And the question next is, how big is the molecule that you can deliver? So we try to deliver polyethylene glycol. At the end of the polyethylene glycol, we label them with the dye, near IR dye. So here again, the control. This is without our peptide, and with our peptide, you can see the enhancement in the brain. So next, what we say, well, how about the opening? How long is the blood-brain barrier open? So that's kind of critical. So what we did, we deliver the peptide first, presumably the junctions open, and then wait 60 minutes and deliver the dye. So as you can see, there's no difference between the negative control and our HAV peptide. So we repeat it. I won't show you the data. We repeat this experiment using MRI. The same thing happens. We can see they close below 60 minutes. So we are quite happy about that because our molecules will open the blood-brain barrier at certain duration and then it closes. Okay, so if you are interested, this is the paper. We published this in 2014. So the next thing we want to know, because lots of peptide now have been used as drugs. We want to know if we can deliver peptides. So here we are working with this peptide for controlling immune response. We want to know if we can deliver them to the brain. We conjugate them with the IR dye, and then we deliver them into mice, and then we can see this is a control, and then you can see the enhancement in the brain in the presence of our ADTC5 peptides. Okay, so normally the enhancements is about 2 to 4 times depending on the molecules and depending also on the modulator, either HAV or ADT peptides. So next, what we want to do is asking questions. You know, when you look at the image, the near-IR image, the image is representing the label, right? So what we are doing is we are delivering label molecule. When they get into the brain, we look at the image. So what would happen if the molecule or the peptides or the protein get degraded? And it means what you're seeing may be not the intact peptide. So we want to prove that what will happen if we deliver peptide without label and then isolate them from the brain and detect them. Do you still see the peptide or the fragment of it? So here we develop LC-MS method. Here is the retention of the CIBR, and we have internal standard. The internal standard is mutation of one residue of CIBR. So you can see the HPLC retention a little bit different. And then this is the retention of our modulator, the ADTC5. And we can isolate actually the CIBR peptide and the modulator in the brain. And then how much it is, we can quantitate them. And it's about 4 times enhanced in the brain. So we're quite happy with this because now we're certain that what we see in the brain using near-IR scanning also reflected with the intact molecules. So after that, we are interested in looking at larger molecules because as I told you before, lots of people are interested in delivering antibodies, enzymes, nerve growth factors. So we are looking at proteins. So here we're using MRI. Again, we are delivering galbumin. What it is albumin actually, but it is conjugated to MRI enhancing agent. So as you can see, here is the control, but after 9 minutes, you can see a lot of them in the brain. And then what we are doing here, we are comparing HAV peptide and ADT peptide. As you can see, they enhance the brain deposition. It seems, again, ADT peptide is better in enhancing this protein to the brain than the HAV. And again, you can see this trend. The posterior is higher because you have lots of vessel in the back of your brain, and go forward to the anterior. So the big question is, how about antibody? Because lots of antibody being developed or even in the market as drugs. So here we check if our antibody really intact. We see some impurities, which is the heavy chain and light chain a little bit. But the majority of the antibody that we use is intact. So on the left here, when we inject the antibody, and you cannot see much of them get into the brain, okay? And then if you deliver them with our peptide, and you can see a lot of them into the brain. If you see that movement, it's actually 8 slices of the brain from the bottom to the top. So those are the movement there. If you integrate them, you can see a ratio between about 4.7 times enter the brain here. So this is quite beautiful, and we've been able to repeat this many times. But sometimes just by integrating the image is not sufficient. We want to make quantitative methods on this. So here, as an example, we are trying to deliver lysozyme, okay? Lysozyme, and we are trying to compare, can we compare HAV and ADT peptides? So here is the image of lysozyme alone, and the second one here, the image of lysozyme with our HAV6, and the right one is lysozyme with ADT-C5. And this is the image of when we homogenize them and try to integrate the image. So here, what we see is that we can consistently see that the HAV and ADT can enhance the delivery of lysozyme to the brain. This is the control, and HAV and ADT here. And ADT is quite, it's a better molecule, better modulator than HAV6. Here, when we increase the size this is about 14 kD to 65 kD, you can see ADT, again, better than the HAV. Now, in this experiment, the dose of albumin is so much lower than the one that I've shown you before with galbumin. Okay, so, and then as you go to bigger molecule with 150 kD molecule with antibody, you can see HAV cannot modulate the junction very effectively for big molecules, but ADT-C5 can. So this is pretty good. So far, what I'm showing you is that molecules get delivered to the brain of healthy animals, and there's no disease, just normal. Now, what will happen if we deliver them to 3 different brain disease models? So this is what I'm going to show you. So we want to look at a model for multiple sclerosis, model for Alzheimer's, and brain tumor. So for MS and Alzheimer's disease, we would like to deliver BDNF because BDNF has been shown to improve regeneration of neurons. The way they did it usually by drilling a hole in the skull, and just like ICV. But what we want to do is we want to deliver them via IV, so it's more convenient, just like in the delivering other drugs, other proteins. So as you know, multiple sclerosis is autoimmune disease. What happens, your immune cell infiltrate your blood-brain barrier and start damaging your myelin in the axon. So normally, if people who has MS, the current drugs is just to stop the progression. But once you get it, once your myelin damage, you cannot fix it. So if you can deliver molecules that can regenerate the myelin, it's a big thing. So that's the reason we are targeting the brain using BDNF. So try to deliver BDNF to the brain. So here we use Western blot. So we're trying to deliver BDNF with ADT. And this is still not disease animal, just to make sure that the BDNF gets in. This is a Western blot. So this is the just regular BDNF. And when we deliver them to the brain without any ADT-C5, you can't see very much of BDNF in the brain. In low dose, we start seeing the BDNF. Here's the dose. And when you double the dose, you can see BDNF in the brain. So we are quite happy about this. And usually when you deliver BDNF, they trigger phosphorylation of receptor called TRKB. So in this case, we are trying to look at the TRKB here with Western blot. And this is when we deliver BDNF alone. There's no phosphorylation. But when we deliver our BDNF with ADTC5, you can see phosphorylation. And you can see the concentration dependent because the dose that we deliver is half the dose here on the left. So question is it going to work in the animal to reverse the disease or at least to suppress the disease? So we use this MS model called EAE. And there are two models. Right now we are using the relapsing and remitting model. And you can score them from 1 to 5. So 1 is the tail becomes dragging, and then they paralyze the back limb, the back limb. And then as the disease progresses, they have the front limb become paralyzed. So here, when we stimulate the disease, they get the disease day 9, they peak at day 13 and go back down, so it's about day 21. That's what we call it in remit. So they remit and then they go relapse again after day 27, 28, and then they become paralyzed again. In fact, they become walking again and paralyzed again. So what we're trying to do is we try to stop the relapse by injecting with BDNF alone, with PBS, and then with BDNF and our peptide alone also. So here's the data. When we deliver just vehicle, you can see the relapse here. And then when we deliver BDNF alone, the same thing, it's relapse. And then when we deliver our ADT peptide alone, still it relapse, which is the pink here. And then when we deliver BDNF and ADTC5, you can see the suppression of the relapse. And we can just measure under the curve, so it's kind of quantitative. You can see here the 3 arms here without ADTC5, and you can see the score is quite high. And then when you deliver BDNF with ADTC5, with our modulator, you can see the suppression of the disease. Okay. Next, what we want to see is, does the BDNF induce remyelination? Usually, that's what we want to see. Here, when the myelin get damaged, this is the axon. You can see a lot of white spot here, and then this is the one that still intact. So as you can see, the vehicle group has a lot of white spot. This is the way we're trying to quantify them using binary conversion. And then here with BDNF alone, still lots of damage. But when you deliver BDNF with ADTC5, you can see less of white spot. So you can quantify them, as you can see here, the BDNF somehow induce remyelination. The other thing that we want to look at is what we call NG2 cell. NG2 cell is, we call it oligodendrocyte precursor cells. They express NG2. They are the one that produce myelin. They are the one, if you had myelin damage, they are the one that regenerate the myelin and wrap around the axon. So here, as you can see, this is just negative control, and this is vehicle. And then when we do BDNF alone, they are almost similar to the vehicle. In fact, it's been a bit lower. And when we add BDNF and ADTC5, you can see the enhancement of the NG2 receptor in the brain, and that reflected of the NG2 cells where the remyelination happens. Okay, so the other thing that we are looking at is protein that induce when you have neuroregeneration. What we are looking at is ERK1 and ARC, and also NOS. But NOS, we didn't see any difference. But here, you can see clearly difference in the expression of the mRNA of EGR1 and ARC here when we treat them with BDNF and ADTC5. Now here is the two control, okay? And so we're quite happy about this and see there is BDNF get into brain, and then the BDNF do its job in remyelination and neuroregeneration. So there's lots to do to see what happens. Okay, so what will happen if we deliver again the BDNF using our peptide in transgenic APP PS1 mice? So here is an Alzheimer's animal model. So what we did, we used 6 months APP PS1 animal. We have 3 arms. One is BDNF with our peptide, and the second one is BDNF alone and vehicle. So what we did, we inject them IV every 4 days, okay? And then we look at the behavior with Y-maze and then with novel object recognition. And we also look at the NG2 upregulation and then also the mRNA of ERK1 and ARK. So how do the maze work? So what we do is we close one of the arm here and let the mice familiar itself here. And then we open the gate here, and then the smart one will explore. So we measure how long they spend time in the new arm, or how many times they enter. So that way we can compare them. So here we see a vehicle and BDNF alone. This is where looking at percent time spent in the third arm, and they are about the same. And then when we look at the animals with BDNF and ADTC5, we can see an increase in the cognitive behavior. Now here is the number of entry of the third arm. You can see also the enhancement compared to BDNF and vehicle. So this is quite good. And then we can look at another behavior model. And the other model is by looking at novel object recognition. First, we ask the mice to recognize these 2 same objects. And then after 24 hours later, we introduce a novel object. If the animal's behavior is improved, they will explore the new objects. So that's how we score them. So here, again, we look at the time interacting with the novel object. As you can see here is the vehicle, the BDNF alone. There's some improvement, seems to me. And also, when you use the BDNF, you can see the clear improvement here. Now, this is as a control. This is the total time interacting. It means for both objects. So the total time interacting, the same for all of them. So it's clearly that the BDNF animals more curious than the other one. So we are quite happy about this, and then we look at the next model is brain tumor model. This is a medulloblastoma model that we are trying to look at. And my collaborator interested in delivering anti-cancer drug called adenosine. As you can see, if you deliver adenosine alone to the brain, we isolate the brain and then determine the amount in the brain. There's not much in the brain, basically. But if you use our peptide, our HAV peptide, with different dose of adenosine, you can see enhancement, quite a bit of enhancement in the brain. So, and then if you inject it three dose, 3 times subsequently, you can see a really nice enhancement here in the brain. So we said, okay, what would happen if we look at the medulloblastoma? So if you look at here, we have placebo and adenosine alone. They almost have the same percent survival. So at the day 21, almost 100% animal dies of the brain tumor. But when we deliver adenosine with HAV, you can see the extension of the survival, and 50% survive. If you continue treatment after the survival, you can see at least the brain tumor totally gone in the animal. So this is the data. You can see the placebo here, day 10 and 20. You can see the tumors enhanced. The adenosine, same thing, enhanced size. And then with the ADT HAV6, with the modulator, you can see the shrinking of the tumor. And so this is the radius of the tumor when you look at the day. And here you pretty much constant for the treated with adenosine and HAV. So what we have so far is we've been able to treat animals, EA mouse, and see there's a remyelination and somehow suppression of relapse. And then we also look at the Alzheimer's disease mice. We can see the improvement of cognitive behavior. And we see that we can use the HAV and ADT peptides to deliver small to large molecules. And we know that for proteins, at least ADTC5 is better. And currently, we are trying to optimize the ADT and HAV peptide and try to modulate, which one is best for what and how to fine-tune the dose for delivering small and large molecules. So I would like to thank you. First, I'm going to thank the support from NIH and also from Caillou Alzheimer's Disease Center. And we have lots of students and postdocs and my collaborator in Brain Imaging Center, and from Lawrence also. Dr. Zhao is expert in Alzheimer's, and also Dr. Miller, and who are doing a lots of delivery to using, he's expert in blood-brain barrier. And then Dr. Vannan is expert in the brain tumor. Thank you very much for listening to me. I would be interested in questions.
Yes, thank you, Dr. Teruna, for so complete presentation. This is the time for questions. There are two options. You can open your microphone, or you can write it on the chat and we will read it for you. Pueden escribir sus dudas o pueden abrir el micrófono. Yo haré el esfuerzo para traducir las preguntas y hacérselas al Dr. Teruna. I will translate the questions if they are in Spanish so Dr. Teruna can answer them. Sí, Aldin.
Yes, I have a question. I noticed that that this is being recorded. Is it going to be available to us to watch?
That will be a question for Dr. Luis Villarreal. I don't think he's present at the moment. I don't know if the recording will be available at our webpage. Dr. Luis, can you answer that, please?
Yes, I will share the video and the conference in the Receipt YouTube platform.
Okay, thank you, Doctor. Is there any other comment, question?
I think someone raised the hand.
Yes,
there
I
is a
think
question.
It was Aldin Mendoza, I think. There are no other hands.
There's a question asking about, does it modulate other membranes?
Yes. Mm-hmm.
Okay,
so
that's a very good question. So obviously, adherins, usually you find them in fact, in the blood-brain barrier, intestinal mucosa. You can find them in the lung and the kidney. It will be obviously you have to target them to certain tissue, right? You don't want to open all the barrier. So our goal in the future, basically, to look at other organs, what is affected. Although actually we already begin to look at it. It's interesting. We can use peptides also to improve delivery through intestinal mucosa. And then we also, when we deliver them IV, we can see a little bit modulating the intestinal mucosa and other part don't remember exactly. It's in our paper. I think it modulates the lung. And so every time we design a new one, we look at different tissue and organs to see if they are opening. So the interesting part is the blood-brain barrier has what we call it VE cadherin, but the VE cadherin in the brain is almost similar to the E cadherin. So what we are doing now is we are using computational chemistry, try to design to target the molecules directly to the VE cadherin with hopefully only limited effect to the other parts. So the other way to do it is to deliver directly IV through the carotid artery here, so it will reach the brain. And we want design the peptide so stable that it will affect other places. So that's a good question.
Okay, thank you, Doctor. Are there any other questions? You can write them on the chat or raise your hand to open your microphone. Okay. Karen says there's another tests that can be used to test the cognitive ability in the Alzheimer's cases. Is another tests. Mm-hmm.
There are probably a lot of other tests, but we don't have it. So because the one that my collaborator used to use is the Y-maze and the novel object recognitions, and then that two models actually acceptable in the field of Alzheimer's, so we are using that. And I'm not expert in the Alzheimer's disease, but those are the two that we use, so I maybe don't answer your question. So.
Okay, was it a complete answer, Karen? Was it the scope of the question?
Did I answer the question maybe? Or maybe,
Mm-hmm.
Oh yeah, it's fine, thank you. Yeah, thank you.
Okay. Yeah. Is there any other question on the public? Recuerden que puede ser en inglés o en español. Las preguntas pueden escribirlas y nosotros las comunicaremos en inglés para ustedes.
Yeah, the other thing is, if you have a chance to look at the recording, most of my slides has a paper at the bottom. It's cited. So if you really want to look at the paper, I mean, I'm picking out slides from the paper, so you can read the paper in detail. So almost every slide has a paper on it. So.
Okay, are these papers available, fully available online?
Yeah. In fact, some of them, because most of my work is supported by NIH, because after a year there's no embargo. So the one that and then a couple of them actually online, like open access, so you can look at it. The other thing that I usually what happens is put it in my website or my Pharmaceutical website. You can click it and it'll go to the paper directly.
Okay, thank you, Doctor. Any other questions, comments, remarks from the public? Okay, Jose Manuel.
There's one. It says, peptide you use commercially available. You can buy the peptide from vendors. So you know the sequence. You can just order them because it's published, right? So some of the peptide that we protect, we already protected them. Especially the very last paper, we had designed a new cyclic peptide. That one's protected, but most of the peptide that we use is published, and you can buy and you can test yourself.
Thanks for the answer. Are there any other questions from the public?
So just additional information. There's a lot of Chinese company that sell peptide, and then depending on how many residue you have, they can sell crude or they can sell purified. Maybe one residue, $25 per residue, US dollars. I don't know, depending on what company. So you can do that if you want to. And the other part is if you want to collaborate with me, we can communicate. So there's another avenue. So.
Okay, for that, we will make sure to communicate to the general public, whoever is interested in collaboration, to communicate the contacts of Dr. Teruna. And you can contact Dr. Luis Villarreal for that. Yeah.
Okay, good. So the other thing is I'm used to collaboration. If you look at all my papers, we have lots of different institutions and we collaborate with them. So.
Yes, Aldin? See, Aldin?
Yeah, so my question is how promising is this current research, and when do you think you'll be able to do human trials with this treatment?
Yeah, so that's a really big question. So yeah, we are in the preclinical right now, and it depends on who are willing to work with us. Because university, we cannot develop a drug right from the university. We can only partner with somebody. So I would just say this: we are collaborating with a company, try to work with them, try to deliver molecules to the brain. So try to look at least ways in the moving from preclinical to bigger animals, basically. So I can just say you that.
Thank you.
Yes, Norma Flores.
Oh, hi. Thank you very much for the conference, Dr. Siahaan. About where you were talking about how to know which one is the particle that you can use for the library. You was saying then computational chemistry is an option. So that is my area. I work in computational chemistry. So I'm asking you, have you been used nanodiamonds?
No, right now we don't. See, the problem with you're talking about particles, nanodiamond particles. Yeah, the problem with particles usually, it's very difficult to let particles penetrate the blood-brain barrier because the junction is pretty small.
Okay.
And the people try to deliver particles, some of them successful, but what they did is they put the particles, they put like a antibody on the surface. Because blood-brain barrier has this receptor called transferrin receptor. The receptor usually carry transferrin, but because your brain needs iron, so there's a lot of them in the blood-brain barrier. So what people have done is they put antibody on the surface, they conjugate it, that bind to the receptor, and this receptor has been known to be recycled, so they get into the cytoplasmic and go to the brain. So people have been doing that. The only problem with that right now is sometimes the antibody that they use is too tight, so they get to the brain side, not much letting go in the brain. Okay. So they are trying to modulate that right now, try to engineer so they don't bind too tight, so they can release. But that's a lot of people put also peptides, different peptides. There's a new peptide, they call it angiotensin peptide. If you want the paper, just send me email. I'll send you the paper. We write lots of review papers on this. I can send you my review papers, and you can use that. And they are using ang peptide and then CPP peptide, which is cell-penetrating peptide combination. They claim they are able to deliver to the brain. So I can send you my review paper, and then you can read it and continue.
That's going to be perfect. Thank you very much. Yeah. We were working with nanodiamonds, and we use lactic acid, and we joined it to tamoxifen. It's anti-cancer for breast cancer. Yeah. And also in the institution, and other people made a size with cellular, and we were successful. We were success. That's the thing. Yeah. And maybe we can later be collaborating, or I can send you our information and you can send me yours. That will be great. Yeah. Thank you very much.
Yeah. So my specialty is basically how you target molecules to specific tissue. So there are two areas of research. I'm presenting only one of them. We are quite interested in the brain, how to deliver molecule to the brain. Yeah. And then the other one, how to deliver molecule to immune cells.
Yep.
So your technology, for example, if you use our peptide, you can target the immune cell, but maybe it's not viable for brain, but you have to use other molecules like antibody for that. Yes. I'm willing to help if you need information, because this is my field for 30 years. So
thank you.
To direct you on that. So.
Thank you very much. Okay. Thank you, Dr. Murga.
Thank you, Dr. Norma Flores. Is there any other questions in the room? Okay, again.
I'm sorry. I was checking out. I'm sorry.
Okay.
It's okay. Okay, bye-bye.
Any other questions? You can write them or you can open your microphone. ¿Alguna otra pregunta? We have good time to make any other remarks or questions. Tenemos un poco más de tiempo para hacer preguntas. Aprovechen. I will assume the public is writing or trying to write their questions on the chat.
Okay. Yeah.
Yes, María Teresa.
¿Puede ser en español?
Claro. Yo hago la traducción para el doctor Teruna.
Yo quería hacer la pregunta en cuanto al campo ético. Vemos que con algunas clases de material particulado, nanoparticulado, por ejemplo lípidos, podemos conducir las drogas farmacéuticas al cerebro. Pero desde el punto de vista ético, ¿cuál sería la limitación? O sea, ¿hay controles con respecto a eso? Porque si con los lípidos podemos introducir cualquier material, por tóxico que parezca o que sea, ¿qué limitaciones éticas hay al respecto?
Okay, so the question is in the ethical aspect, which are the constrictions or limitations of doing the trials or working with the brain for users or participants in the experiments?
Yeah, so right now we don't like I said, we just only the preclinical, right? So it's only in the animal study. So we don't have any human study. So the other thing to look at is actually this type of method has been used to treat brain tumor patients. So there's a way to use to modulate the blood-brain barrier using hypertonic mannitol. So when you inject hypertonic mannitol through the carotid artery here, they shrink the blood-brain barrier, and they've been able to deliver anti-cancer drug. That method is approved, and people have been using this method to deliver anti-cancer drug to brain tumor patients, and they've been successful doing that. Now, of course, our method is different. We are more modulating protein-protein interaction. The concern is similar with their method. Their method usually they side effect, but for terminally ill patient, they can extend their their life. They're taking those method like the mannitol method, this osmotic method they call it, by shrinking the blood-brain barrier using hypertonic mannitol. Now, our method is not shrinking the blood-brain barrier, letting it the same. It's just making it porous, and that's the reason the time of modulation is really important, because you don't want to let other molecules get into the brain. So I didn't mention this actually. We deliver antibody, but when we try to deliver fibronectin, which has molecular weight 220 kilodalton, they cannot get in. So there is a limit, size limit for the opening. So that's the one that we're trying to fine tune. How big is the opening and how long? We don't want it to be too long. So that's, if you thinking about the ethical issue, right? What is the side effects of doing that? So that's down the line. Yeah, we have to make sure it's safe.
Thank you, Dr. Teruna. I don't know if María Teresa fue clara la respuesta o alguna duda adicional sobre ese sentido.
Yes, thank you.
Okay. Yes, Dr. Luis Villarreal.
Thank you for the speech, Dr. Teruna. Behalf of the Congress team, we want to thank you for your participation, for your presence. In personal, I love your presentation, because we work with drug delivery systems in this university, but I work with synthesizing electrospoon nanofibers. I don't know if you have been here about.
Yeah.
So I work with Dr. Cornejo, is one of the doctor that ask you some questions. Mm-hmm. So we work in different delivery system for topical release or oral release. I have many students that always wants to work with brain. Mm-hmm. They always ask me about where I can seek a research related with brain. So now I know you, and I will recommend you, and hope we can work together in the future. So we always active in research and try to work in different topics, right?
Yeah.
So I will contact you later to collaborate, and if any of the assistants here are interested to contact Dr. Teruna, well, I can help.
Yeah, so in that note is actually I'm the director of Global Health Center here, and what our mission is to have a connection with the outside world. So KU, like I have a connection with Indonesia, because I'm originally from Indonesia. So we make some kind of arrangement, and we have a lot of connection with Thailand. So let's say you're a student interested in studying here for a year, and if they have a support for a year, you can come here. And sometimes I support them to come here if they want to learn, if I have funding. But I cannot promise that because sometimes, I have lots of students here itself want to work. But we can collaborate that way. Right now, I have one student from Thailand. Will be here for 1 year. She came at the end of August, and one student from Indonesia. She'll be here for 6 months. She came 3 weeks ago. So we set up a collaboration that way, and then we publish paper together. So that's an opportunity. I never have somebody from Mexico. Actually, I did my graduate work in Arizona, and then I did work in San Diego, and used to cross Tijuana. So, yeah, I'm open to it. So anybody, contact the advisor, and we work through the advisor.
That's great, Doctor. Yeah, we have also tried to effort to bring some international students.
Mm-hmm.
Maybe next year we will have an Indian researcher for a postdoctoral position. So we try that, no? And thank you, and we will seek collaboration in starting with this program that you said. We know that always is not is not sure about some to get some internships or some grants, but we can try. And I think Mexicans are well known in the world to be hard workers.
Yeah, and also the other part is I would just want to advertise our department. Our department is a good department, one of the top in the country, and we place our students in industry. We have a graduate program, although we are very selective to recruit the students. So if you have a really bright student you want to send to us, if they pass the interview, you're in.
Right.
We support them as a teaching, not teaching, we have research assistant. We are very selective. We only hire 10 or less every year, depending on the funding. But if you find somebody who's really bright, they want to work in US, send them to me. And then if they pass the interview, because I cannot decide, but the whole faculty has to decide. But that's another avenue that I'm trying to advertise. So
that's great. That's great. Thank you very much.
Yeah.
And thank you for coming.
No problem.
Thank you, Dr. Luis Villarreal. There's time for a final question? Is there anyone else wanting to make any other comment, remark, question? Okay, so just remember that we have 3 forums, 3 thematic forums at 11 o'clock Pacific time, applied bioengineering, mechanical design and manufacture, and nanotechnology. I will copy the links or present them. Okay, so these thematic forums are happening from 11 to 15 hours. And Dr. Luis Villarreal is doing us the favor to copy the links on the chat so you can enter on the thematic forum of your interest. Any final question from the public? ¿Alguna pregunta final del público? Puede ser en español, puede ser escrita en el chat. Puede ser también con el micrófono. Okay, so don't forget to register your assistants in the Google Forms that is shared on the chat. Be sure to click on the link. And por favor, no olviden registrarse en los links de Google Forms que están compartiendo el doctor Luis Villarreal en el chat. Eso nos ayudará muchísimo a dar seguimiento a los indicadores del Congreso. Entonces, por favor, den clic. And I think I thank you so much, Dr. Teruna, Siahaan. I think this will be all for your lecture. Thank you so much. I bet many researchers will be contacting you, and there will be so much opportunities from the UABC to your institution. And I hopefully will be in contact soon. So thank you so much for your lecture. If you're interested in entering in the thematic forums or other keynote conferences, please let me know.
Okay, thank you.